As we look to the future and the financial position of the institution, it's imperative that we operate in an efficient and responsible manner, and we are doing that. I'm very happy to report that our fund balances are increasing. Those fund balances become our way of investing in our priorities and our strategic goals. A critical reason why we are in good shape as an institution has been the support we've received from our broader community for our 5-year campaign, The Vision and the Promise. The Optometric Center of New York, the college's affiliated foundation, was able to close that campaign with over $10 million committed. We have to thank our staff, our administration, our alumni, corporate partners, but most critically our Board of Trustees of the Foundation for their support. It was the first campaign of its kind in the history of the college, and in fact it was a smashing success. We've been able to do some major renovations over the past few years, and in fact this year we just completed 2 lecture halls. This coming year we will be finishing the lobby of the first floor. That's certainly going to make the college much more warm and welcoming to those who come, but we also have had a partnership, or are in partnership, with Purchase College and the Newburgh Museum to establish their art gallery in New York City. As we look to the future, we're going to continue to address critical maintenance issues. We are going to be looking at the construction or build out at the basement mezzanine levels, and I'm actually pleased to share with you that we will be using that newly repurposed space for the purpose of upgrading our clinical and other teaching laboratories. We are fortunate to have an excellent faculty who are highly committed to their purpose and their programs, but we do have a challenge, and that is that we are seeing a number of those faculty who have dedicated their lives to the college begin to retire. It provides us with an opportunity, but it also provides us with a challenge, and that challenge is to build a faculty of excellence for the future, understanding the future of the profession of optometry and the future directions for critical research. But to do that, one of our challenges is going to be to have to review and upgrade our compensation program so that we can assure that we are attracting the best faculty. I'm pleased to share that our students continue to be an excellent group of individuals. Their admissions tests, we are one of the leading institutions in the country in terms of admission test averages. We have very carefully adjusted tuition over the past few years, and some of that has been because of decreased state support on a percentage basis. But we have to be very cognitive of maintaining an affordable education and ensuring that our students do not graduate with such debt that their decisions and career decisions are limited. Our ultimate pass rate, the number of students who have passed all parts of their National Board of Graduation, remains among the highest in the country with 97%. Our graduate program also has demonstrated over the past few years significant reform and changes, and it is evident in the applicant pool that we are receiving for that program. And thanks to the leadership of Dean Troilo and Associate Dean Bloomfield, that program is certainly gaining in stature over time. We are emphasizing evidence-based medicine in their educational programs, and quite critically, we are turning our attention to the importance of interprofessional or team-based care of patients. This year, we do have an exciting new program that's been initiated. It's actually a blend of the graduate program and the residency program. This program will allow PhD or master's students to also complete an accredited residency program simultaneously. We continue to expand our international reach. Many of you are familiar with the work that we've done in China. That continues, but we've also begun to do some significant partnering with the University of KwaZulu-Natal in South Africa. We are helping that country to expand their scope of practice by educating optometrists in conjunction with the university there to the use of therapeutic pharmaceuticals. We must continue our commitment to expand and grow our clinical, translation, and basic research programs. We are in the middle of trying to procure and receive human subject research accreditation, a very arduous but important validation of our research programs. I'm happy to share with you that this year our faculty delivered 167 invited talks, publications, or presentations at peer-reviewed conferences. It is the highest number of presentations, talks, and publications that our faculty has produced in the last 10 years. Our University Eye Center, which serves tens of thousands of patients on an annual basis, continues to do well. The number of patients served and the Certainly revenues generated through that endeavor have remained relatively stable in the past 5 years. We need to redouble our efforts to reach and provide access to care for a greater proportion of our community. Our referral center continues to thrive. Each year, I never cease to be amazed that it increases in terms of the number of referrals and patient visits from the broader healthcare community, whether it's from other optometrists, ophthalmologists, pediatricians, internists, schools. We are seeing a greater number of patients referred to our University Eye Center. We are implementing a new generation of electronic health record. That will be a tremendous challenge, but it should benefit our patients, and it should make life much easier for our staff, our faculty, and our administration as we look forward. We've been doing some modifications in terms of the administrative structure, and we are looking for a new executive director of the University Eye Center. And we fully expect to bring that search to a successful conclusion within the next month or two. Our strategic plan for 2013 through 2018 is the blueprint, by which we plan, allocate resources, and move into the future. But it's important to think beyond 5 years. 5 years is really not that long a period of time. From an infrastructure standpoint, I think it's a critical priority that we really move forward and complete the redesign and reconstruction of the University Eye Center. It has to incorporate a contemporary model for clinical education into patient care, and it has to facilitate our leadership through the continued development of a prominent clinical research program. Most critically, it has to provide excellent patient care to the people of New York. We have partnerships with institutions such as Woodhull Medical Center, Lutheran Medical Center, East New York Diagnostic and Treatment Center, but we need to expand that. We need to expand it in significant ways, such that we really are core partners collaborating with major hospital and community health center systems in New York. Indeed, we should be striving to become a significant participant in critical healthcare policy decisions at both the local and at the state levels. We need to be committed to enhancing a cadre of full-time academic clinicians, clinical scientists, who do expand our intellectual footprint through research, clinical scholarship, health policy research, and even the scholarship of teaching. Because we do need to step back and do a fundamental examination of our institutional mission. Examine and consider whether we need to look at offering additional healthcare degree programs, which will create an expanded interprofessional educational environment for our students, provide the State University of New York with additional programming in the New York City area to meet the expanding healthcare needs of the region, and to provide also long-term a more stable, stronger, and diversified financial model for the college's future. I appreciate your participation and support, and I look forward to working with you in the